So common spinal injuries in athletes may range between acute muscle spasm or disc protrusion. Very rarely we see some fractures, some spinal fractures as well. And we see it quite commonly at the moment, particularly after the COVID pandemic, especially because during the COVID pandemic, most people reverted to exercising at home. And with the partial resolution of the pandemic and people starting to go back to the gym, exercising quite heavily and trying to reach the pre-COVID exercise levels or sport level. As a result of that, I see in my clinic so many patients with athletic injuries, and the issue is that there are two problems that we need to resolve at this point in time. Number one is the current injury, and we need to resolve it quite quickly so that it doesn't leave long-term consequences. Two is to help our patients, especially the athletes, to go back to their favorite sports and not to and go back very quickly or as quickly as possible. And in Complex Spine London, in partnership with Cromwell, we found that there are two things that make a huge difference in the outcome of these patients. Number one is the multidisciplinary approach, with the surgeons, pain management consultants, radiologists, rheumatologists, physiotherapists, and even psychologists on board, managing the patient in a comprehensive way in order to secure the best outcome. Number two is patient education, which is quite important because we find that things like improper technique or lack of proper warming up, or the improper use of the machines in the gym might contribute to these injuries. So patient education, the aim is to avoid recurrent injuries or the athlete acquiring a different injury.